Vitamins and minerals, not just in a capsule and tablets, but in the food you eat, and all can make a difference as you try to keep your family healthy. Eating everything from high fructose corn syrup to bleached flour and ingredients we can't even pronounce can deplete your body of the nutrition you need. Did you know even freshly picked fruit loses vitamins by the hour?
It's very interesting, and nutritionists say once fresh fruits and vegetables make their way into your fridge, they get cooked, and then they're eaten, they lost most of their nutritional value. It's gone. So today we're going to walk you through the top 10 vitamins and minerals that many people are lacking. We went over to the office of board-certified nutritionist Dr. Peter Osborne at Town Center Wellness and talked to many of his patients who suffered from deficiencies.
With the proper testing and supplements, they're all on the road to recovery, though. You're going to learn everything from A to zinc today.
We want to start with vitamin E, something many people may take over the counter. Helps the skin. At least that's why I used to take it. We need vitamin E to protect our blood vessels from bad cholesterol and protect our cells from damage. A deficiency can cause immune problems.
Research shows it can benefit conditions ranging from Alzheimer's and Parkinson's disease to arthritis, even skin disorders. Local mom Wendy Whalen says taking supplements has reduced her vitamin deficiencies.
I take a multivitamin, the liquid, and I take E and B's, and that's about it right now.
So how did you feel when you were deficient with all those vitamins?
Tired. Oh, without them? Before I was tired. I had hives, a swollen tongue, itchy eyes. I just always felt really tired, even though I'd sleep 8 hours, you know.
And then you changed your diet as well as added those supplements and started feeling a lot better?
Yes, a lot better.
Vitamin E deficiency can cause a lot of symptoms. One of them is nerve damage. It can actually create neuropathy. It can also cause anemia like the B vitamins. Vitamin E deficiency can cause muscle weakness. So people with vitamin E deficiency oftentimes will develop weakness of the muscles, which is slow and progressive over time. Females with vitamin E deficiency can tend to develop premenstrual type syndromes. Primarily the breast can become more sore. So breast tenderness is a very common symptom of vitamin E deficiency. Hormone abnormalities, irregular periods also can be a deficiency symptom of vitamin E deficiency as well.
I'm a believer. I've been doing it for 2.5 years now, and I don't take Claritin anymore. I had to take that every day, and I don't get hives. I got hives all the time. I've had a lot of immune issues. I've been taking antibiotics since I was 2, and I'm allergic to 8 different antibiotics, so I was kind of frightened. That's kind of how I got here. I'm like, I've got immune issues, and I need to figure out why. And so he kind of took the puzzle and did the SpectraCell, and he goes, don't worry, we'll handle it.
And SpectraCell is something that measures your vitamin levels?
Correct.
And here to talk about that SpectraCell test just mentioned is Dr. Fred Crawford, the Senior Vice President of Operations and Lab Director at SpectraCell. So how can we get tested if we do have a vitamin deficiency? Walk us through that process.
Well, it's a very simple process. A blood specimen is drawn on you, and it's sent to us overnight by Federal Express or some other procedure. We test the blood by growing your cells in culture and determining functional deficiencies of various vitamins, minerals, and antioxidants.
This is just amazing. This is like something NASA that would develop. So specifically a blood sample, then, not necessarily a hair sample.
Yes, it's a blood specimen.
Okay, and then how can we find a doctor to perform that test for us?
Well, the easiest way is to go on the internet and look up SpectraCell.com. And there's a place there where you can plug in the zip code, and it'll tell you doctors in the area that could provide you with the service.
Okay, and then we can take the test in an independent lab, though, or do we have to go to a specific doctor that offers it?
The patient has a number of choices. They can come to our laboratory and actually have the blood drawn, but if they want to bill the test to the insurance company, they should go through the physician. Independent laboratories offer many nutritional tests, but they're not a functional deficiency test.
Okay.
We're the only lab in the United States that performs this kind of procedure.
And I'm glad you mentioned that health insurance does cover the cost.
That's a very complicated question.
Okay.
Generally, yes, but it's becoming increasingly difficult for patients to get insurance companies to pay for many procedures, as I'm sure they know. So it's best to check with us and your doctor specifically about what your policy is and how it will cover the test.
And this is such an interesting concept. So once people find that they're deficient in certain vitamins, then your doctor can work with you to recommend what types of supplements, vitamins you can take?
Well, that's the beautiful thing about our test. I mean, majority of people take a vitamin supplement, but they have no idea what their body needs. Our test will specifically identify the things that your cells need so that they can perform optimally. And then we will make recommendations in our report to how you can successfully replete that deficiency.
So, you know, I would think buy an over-the-counter multivitamin. I should be fine, but bodies work differently and people need different things.
Well, that's the thing. Most people believe that just because you take a supplement that you're correcting the deficiency. A, you had no idea what your deficiency was and what you needed. And B, it's not just simply a matter of taking a supplement. The absorption, how much exercise you get, what kind of drug therapies you may be on for other conditions, they can all induce vitamin deficiencies. And they may not be corrected by simply taking an over-the-counter vitamin. You may need more.
You may need more. And let's say that folks don't have access to this test, which let's just say that they want to tackle this problem on their own. Is there one specific multivitamin that people can take? I mean, probably not, right?
Probably not.
Okay, because I know you're promoting make sure you get that test done, but if I can't get it done, is there anything I should be taking?
Well, I think everyone should be on a good multivitamin and a good multimineral.
Okay.
And some fish oil. But it's also good to be tested to see what specific requirements your body has a need for.
And let's say my family physician doesn't do this test. What then?
Well, that's a very tricky question. I've taught medical school, and I know what we taught in regards to nutrition and vitamins and minerals, and it's not very much. And in some sense, if you really believe in this concept, which has increasingly proven value, then perhaps you should consider looking for another physician.
All right. Thanks so much, Dr.
Oh, you're welcome.
Crawford.
It's a pleasure
Very
being here.
interesting.
Thank
I've
you.
never heard of this before, and I'd love that we can talk about it.